Thank you, MC. I'd like to recognize the presence of my minister, Aden Duale, Minister of Health, the CG from Prisons, and Madam Banis, and all of you. Good morning. I'd like to begin by appreciating all of you for making time to grace this event. At SHA, we know your boots on the ground, ensuring that Kenya is safe. And for that, at SHA, we have a commitment to ensure that you'll be served well. Don't be shy. These are now your clients. This is Dr. Marion. She's the head of benefits. So she's the lady who works out the benefits in the cover, who works out on engaging. Then we have Dr. Golda. Dr. Golda is an actuarist, and she's the one who does our benefit packages. So watu wa hesabu. Hesabu yote ile mnaona kwa limits yenyu. Mr. Lisen is our CFO. He's the one who ensures that SHA money is protected and it is safe. And he does our books. We have Mr. Alio. Mr. Alio is the one who's been ensuring this event is successful. He does our administration at SHA. He's our DCS. We have Parken. Parken ndio anaangalia hesabu. Pali tunasikia tukisema kuna fraud. Yule ndio ananiambia kuna fraud, and hapo ita Mr. Amin akuje angalie mambo hapo. So this is the team from SHA, and we have other officers at the back who support them. We have Brian, you can wave, and Minnie, you can wave, and other officers who are in the audience. So before I come back to the microphone, because I want to really explain to you why we're here today and why you're onboarding into this service, I'd like to invite Engineer Lenaira, who is a twin of SHA. Engineer Lenaira runs what is known as a digital health agency, and that is the backbone and the system that we use for this program. So Engineer, come in. And I'll stand, you have 1 minute, I'll stand next to you.
My team is so tough on me. Honorable CS for Health, CS Interior, the IG, and all other protocol observed. Allow me, because of time, to use the protocol as already established and continue to make a few remarks. Thank you, Waziri. It's true that we, the Digital Health Agency, is the twin of Social Health Authority. We are the people who run the system that the Social Health Authority will provide services to you. Waziri, I want to confirm that the transition has been very smooth. We have been able to transition all officers who were in the former scheme, and they are now being treated within the system of the Social Health Authority. In terms of numbers, we are able to, Mercy will give more details, but we have almost 4,656 officers that are already transitioned and are being treated without any challenge. I also want Honorable CS to give my commitment and the commitment of the Digital Health Agency that all our teams are on top alert for the next 1 month, and we have also our teams that are dedicated who will ensure that no officer in uniform will have challenges at the hospitals because of system. We have a dedicated line that we have established together with SHA and the police, whereby when you have any challenge, we should be able to address in the shortest time possible. Honorable CS, SHA is fully digital. So there are no cards, there are no documents to sign. The only thing you need is your finger and your national identity card. Please, when you go to the hospitals, carry your ID. That is the only thing that you need, and of course your fingers for identification. And as I speak that, there's something I want to communicate that is very important. One, there is an application called Afya Yangu app. Please, if you have your phone as a uniformed police officer, download Afya Yangu app. Why do you need the Afya Yangu app? Because it's going to support you in key areas. Number one, your dependents. This is your spouse and your children. That is the place where you can add them. That is the place where you can confirm them. That is the place where you can report in case there is any that is not your dependent. So for your dependents to be able to access services, please ensure that they are on your profile in the Afya Yangu app. Second, That have been contracted by SHA, we have also made it available there, so that you are on your phone, you're able to see which hospital you can go, which one is near you, and which one has been contracted by the.
We major in cardiology, and you are well fast with a Mad Heart Run, and therefore I'm inviting all of you to participate in the Mad Heart Run, so that run program. And therefore, it's really a real privilege, and I promise and I commit myself 200% to support the police service and the police on service when they come to us. Karibuni, matter where you matter most.
Thank you, So, as we come to this is my next job, this one that you're doing. As we come to this part of the program, Waziri, this morning when I woke up at 5 a.m., my blood pressure was 140/90. Good or bad? Good or bad, Dr. Good or bad? 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 Bad. What is your blood pressure today? You checked. So what is it? She's saying 128/68. As a doctor with my hat on, that's good. What was your blood pressure? You didn't check. Did you check your blood pressure last year? Yango, last year? No. And you're okay? You think you're okay? Bwana Dia Jema Sengeli, what is your blood pressure? Why am I saying this? Under the SHA cover that you have, you will have one annual free checkup for all your vitals, all your lab tests. You don't even have to be sick. Let me repeat this, discipline forces. You do not have to be sick. Kesho, ukisema nataka kujua blood pressure yangu ni nini, if you go to any of these providers, beyond blood pressure, usema you want to know your mafuta, you want to know if your kidneys are working, you want to know if the drink you had last week messed with your liver, you can come in to the provider and we will give you that annual check for free. The bad news is that we've noticed in all the clients who we are seeing under the Public Officers Medical Scheme, utilization of this free check is just 2%. Why are we afraid of knowing our blood pressure? Mine was 140/90, but now it's coming down because I think the event is going well. That's why it was high. So with that, I would like to introduce Madam Banis, who has been a shield, a rock, and we've been planning this together with her. I'm sure she's a familiar face. She'll take on the program after this. Thank you. Welcome, Madam Banis. Asante.
Cabinet Secretary, Ministry of Interior National Administration, Mr. Onesmus Kipchumba Murkomen, Cabinet Secretary, Ministry of Health, thank you. Honorable Duale, Deputy Head of Public Service, Chair, National Police Service Commission, Inspector General of Police, and allow me to guide on existing protocols. It's a pleasure to be here this morning to mark the beginning of Usalama. And before I move on, I'd like us to appreciate Dr. Mwangangi and the health team. They did a fantastic job. So going forward, now we are in the discipline side of the event. And it's important to learn that this is a very good collaboration between the Ministry of Health and National Police Service under the Ministry of Interior. So we are here to launch this cover. It's a very critical cover, Waziri, both Waziris, because it serves the most unique service, who are people who work throughout the day to ensure that this country is safe and secure. They work in remote part of this country, in border
And sometimes, as the people of Kenya, nobody tells them thank you, nobody appreciates them. So it's a very important cohort. So we appreciate you on behalf of government as you deliver on that important assignment. So just from the onset, allow me to demystify many things that have been said before, that we are moving the police from a good cover to a bad cover. This is a very good cover because it still will serve the police from a perspective of where we were before. So it was purely private cover running the cover. Now it's the government and running the cover. So nothing has changed. The hospital accessibility is even going to be better. We are moving our uniformed police and prison officers from accessing 1,000 facilities to accessing more than 6,000 facilities. See, that's a better access. And we are convinced, as your leadership and our cabinet secretary, Mr. Murkomen, will comment, as well as his counterpart, Mr. Duale, that we are convinced beyond reasonable doubt that we have a public responsibility to ensure that we give you a good cover. As you protect the country, as you do a lot to ensure that Kenya is safe and the rest of Africa is safe and secure, we also have a mandate to ensure that you get a dignified cover. So you trust us that as your leadership, we will provide you with the best cover. Thank you very much. So just about the cover, we were able to transition from the 1st of April 2026 from the private cover to Usalama cover. Now we are under Usalama cover. It covers police and prison officers, 138,132. So that is a huge population. We have had a very seamless transition in terms of there was no noise. We were able to transition 190 inpatients from now the other cover without drama and without a problem. We've also negotiated for a very robust benefit package. It covers for outpatient, it covers for mental health, it has an evacuation component, it also has the IVF component for those of us who are still in the childbearing age. And I can confirm that in National Police Service and Kenya Police Service, 70% of our population is still in that childbearing age. So for those will have challenges, we have an IVF cover. There is also a component of mental health and an important component that is meant to evacuate our officers in terms of we'll have faith-based organization, we'll have public organization, and we'll also have private organization like MATA and the rest who spoke here before us. So we take your health as government very, very seriously. My cabinet secretary will speak about other policy discussions. We are also in line with our work, trying to see how to cover the committee that sits between Ministry of Health, SHA, DHA, and National Police Service. And we meet on weekly basis to look at the challenges that will be able to emanate as we might from this other cover to SHA. We've also had regional teams, both from SHA and National Police Service. We formed some teams that we look at the regional level so that they work together in the 47 counties to ensure that this cover is provided for the police without a hitch. I reckon that we'll have a bit of transitional challenges. Please, we have a hotline and we'll have, our own liaison people inside National Police Service and Kenya Prison Service that will be able to contact you in case of any challenges. So I know the ministers and the cabinet secretary will have more to talk about. I've also had a bit of complaint in terms of the package. There's a feeling that it's not enough. Please rest assured
assured that we have excess of loss. And this cover, unlike the other cover, government does not make profit from its citizens. So the amount that we get normally we'll have to utilize, and SHA will track it, and we make sure that in the event that that money, at the end of the year, that money, because we are in a fund, we do a roll out for the next financial year. So for example, if today our budget is 3 million, at the end of June, normally that money will disappear. But now in this arrangement between government to government and the Usalama cover, that money will be rolled out. So please, as you serve the country, be very comfortable. No policeman, we reassure you, or prison officer will go home without care. And no policeman will get substandard care. Our mandate as government is to ensure that we provide efficient, seamless, and good care for our policemen. Having said that, allow me at this juncture to welcome the chairman of the National Police Service Commission. So we want the employer to also acknowledge that they are working with us and to ensure that this cover is good. Karibu sana, Dr. Komora. Asante.
Thank you. Our chief guest, the CS for Health, our CS Interior, Deputy Head of Public Service, IG and the Command, together with DG Prisons, all protocols observed. Allow that I be very brief because of time. I come in just to, one, offer our commitment as the National Police Service Commission to ensure that even as we roll out and transit our police officers and their families into the new scheme, anything policy, Waziri, we are available working with the IG and the other commission members to ensure that then the welfare and wellness of our men and women in uniforms is well taken care of. Yes, we come in as the second largest employer within the public service after Teacher Service Commission that has over 400 employees. We have about almost 110,000. So we have a duty as the National Police Service Commission to ensure that our servicemen are well taken care of, because the wellness, welfare of our police officers ensures them that we also have secure borders, we also have a stable and peaceful environment within which to carry out national development. So I want to unreservedly offer our commitment and support to this initiative and indicate any aspects of policy that will be coming to the Commission, working with the IG and the Command, we are ready and good to go on. Let me encourage all our police officers to embrace this with an open hand, because we have just sampled a few of the services here, just like they exist in many other places. We have excellent offerings that we believe, and honestly so, that our men and women in uniform are safe and secure, and therefore our country, the extension, will continue to be safe and secure. Thank you very much. Best wishes.
So thank you very much. So the employer has verified. You know, in research they say trust but verify.
Honorable Adam Duare, the CS Interior, Honorable Kipchumba Murkomen, the Deputy Head of Public Service, Mr. Amos Gadesha, the Inspector General of Police, my colleagues, the DIG Police, DIG AP, and the DCI, the Secretary Administration and Accounting Officer NPS, Madam Banis, the Chief Executive Officer SHA. Your Chief Guest, allow me to ride on the protocol that has already been established. My colleagues, good morning. Sir, today marks a very significant milestone in our country's journey towards strengthening the welfare of our officers as we witness the launch of the Public Officers Medical Scheme Fund, Usalama cover under the SHA, a comprehensive medical cover tailored for members of the National Police Service and the Kenya Prison Service. This noble initiative, where that 4,000 prison officers, together with their registered dependents, stand to benefit immensely from it. We are particularly encouraged that this scheme provides wide access to accredited health facilities across the country, inclusive of the referral hospital in this country. CS wish to also note that Kenya Prisons facilities have been incorporated in this network. Yeah. So I wish to also to comment that recently we operationalized Wanini Kereri Magereza Level 4 Hospital at Ruiru, where at the moment we are offering outpatient services, and I wish to confirm that very soon we'll also begin inpatient services, and therefore again this will also provide referral services, particularly for our inmates and also the members of staff. It is worth noting that access to quality and affordable health care is not just a privilege, it is a fundamental necessity for a productive and motivated workforce. Sir, I wish to confirm that our officers across the country have all been informed and they have undertaken to embrace SHA registration, and this reflects a positive uptake and confidence in the system. Sir, I want to appeal for, now that we have onboarded into this new service, for expeditious service to our officers when they attend hospitals for services, and also request SHA, CEO is here, that SHA will be able to promptly offer the necessary approvals when requested to enable the officers get services. Now that I'm in charge of prisons, allow me also to appeal to you, CS Health, and also the CEO SHA, for the inmates that appeal that they also be allowed to access treatment across the country in all health facilities, even as we work on the budget to be able to pay for their monthly payments. Hospitals can seek reimbursement once the services has been offered, and I want to appreciate more particularly Kenyatta Hospital, Mbagathi Hospital, Eldoret, Moi Referral Hospital. They have been offering services and then seeking reimbursement and to the inmates, and I want to appreciate this. So as Kenya Prison Service, we want to reaffirm and confirm that we have onboarded and we are here and we embrace SHA Usalama cover going forward. Thank you and God bless us all.